हमें बचपन में सभी को चोट लगी होती है और वो कैसे हील होती है. नाउ इन दिस वीडियो वी आर ट्राइंग टू अंडरस्टैंड हाउ दैट वुंड heals, right? So in today's video we are going to deal with wound healing. What are the factors affecting, what are different types, and what are the stages that are involved in wound healing, right? So but before starting this topic we should know something about skin. It consists of epidermis, dermis and hypodermis. Whenever there is a breakdown in the epidermal layer, that is the wound injury, right? And when there is a breakdown in that continuity, that is called the wound, right? So there are different types of wounds. Types like there's open wound and the closed wound, right? So the open wound are the wound that are in which the underneath surface below epidermis, that underneath area is exposed to the surrounding, right? That is the open wound, where there is a split in the epidermal layer and there is a injury and the underlying structures are exposed to the surrounding. That is the open wound, right? And the closed wound are when the skin is intact and there's a underlying structures are damaged but the skin is intact. So like we have like contusions, hematoma, right? These things are there. That is the closed wound, right? Now before moving towards this wound healing topic, we should know something about skin. Skin is the largest organ of our body. It covers the entire surface of our body, right? We have different stages of wound healing. There are 4 stages of wound healing. First is hemostasis, right? Next is there's inflammation. Third one is proliferation, and the fourth one is the remodeling or the maturation, when there's new tissue forms. Okay, we have the 4 stages: hemostasis, inflammation, proliferation and remodeling or the maturation phase. First we're going to talk about what is hemostasis. Hemostasis means hem means blood, stasis means stopping. Here जब भी wound इंजरी हुई है तो सबसे इम्पोर्टेंट चीज होती है कि हमें ब्लड को स्टॉप करना है ना? और चीजें तो हम बाद में भी कर सकते हैं, बट हियर हमको ब्लड को स्टॉप करना है, मीन्स हीमोस्टेसिस करना है, ब्लड को स्टॉप करना है, राइट? और ब्लड को स्टॉप कैसे करेंगे हम? व्हेन ब्लड कैसे स्टॉप होगा? हाउ दैट liquid form, now blood is flowing, right? Now we have to convert into the gel form or the thicken. We have to and how the blood clots by when the platelet aggregate at that site, right? When the platelet aggregate or adhere to that site, then this liquid blood that is flowing now is converted into the gel form, and now the platelet adhere to that site and forms a fibrin like mesh, and the blood stops by the formation of clot. So first step is in hemostasis, there is a clotting of the blood. By constriction of the blood vessel starts to constrict, and the blood is now there's a clot formation is at that point the blood is clotted. Okay, the blood starts to coagulate, starts to clot at that site and make a plug, so that the blood is not ooze out from that injury, right? So in hemostasis there is the stopping of blood by constricting of the blood vessels and the formation inflammation. Second, we have inflammation. Inflammation is whenever there is, what is inflammation? Inflammation is whenever there is swelling at that site, pain, tenderness, or any type of fever because of that injury. So that is inflammation. Okay, what happens in inflammation? Now RBC role is being played, right? In the blood we have RBC, WBC, platelets. Now there is RBC and the platelet function is being done at the hemostasis point. Now WBC takes charge, right? The first is WBC take charge to remove the microorganisms present there, and how WBC helps by macrophages. What macrophage do? Macrophage helps in phagocytosis. Whatever the foreign microorganisms are there, or any type of infective things are there, they are just try to engulf that thing, right? They try to engulf that thing. So macrophages play as phagocytosis, right? Now, and we have the fibroblast cell also to produce collagen. To fibroblast helps in the formation of collagen to give that that wound strength at that site, right? So in this inflammation phase, because of these things, because macrophages and the fibroblast, everything is there, and at that site there is pain, redness, swelling and tenderness is present at that site. ठीक है, हमने देखा है ना, जब भी चोट लगती है थोड़ी स्वेलिंग आ जाती है और कुछ लिक्विड सा ट्रांसपेरेंट लिक्विड started to ooze out from that site. So that is because that infective thing are being oozing out because of that macrophages, they are doing their functions, right? Now we are moving towards the third one, that is the proliferative phase, right? First is the stopping of blood is being stopped, okay? Now clot is being formed and blood is stopped. Second is we any infective thing that is present is removed out by the macrophages and the fibroblasts, okay? Now these two things are being done. Now we are going to proliferation, right? Formation of that is the epithelial layer that is being damaged now the new tissue is formed, okay? So now there is a proliferation, formation of the new tissue. Now यहाँ पे क्या होगा, epithelial layer दोबारा से regrow करना start करेगी, right? Now we are moving with the proliferation phase. In proliferation phase, what happens? The epithelial layer that is being break down or any damage happens to the underlying structure. Now everything is being sorted out by formation of the new tissue, right? Now here the epithelialization is there. Epithelial cells started to regrow in upward direction and outward direction, right? And the formation of crust. Finally, the crust is or the scab is being formed in this proliferative phase, right? Now we are, और आपने देखा भी होगा जब चोट लग जाती है उसके बाद एक ब्राउन सा एक कुछ क्रस्ट बनने लग जाता है, ठीक है? That is you are in the proliferative phase. Now we are moving towards the maturation or the remodeling phase. Now the tissue is the new tissue is being formed. That scab is become dry and started to fall. So in this what happens, the fibrous tissue rearrange, okay? Rearranging of the fibrous tissue is there, and there's a collagen formation is there. Because of that, it gives the strength and flexibility to that wound. And the scab that is very dry now is started to fall off, and there's a red shining scar you will see, and formation of new tissue, the remodeling, everything is rearranged, right? And the formation of new tissue. It's all about wound healing. If you like this topic, please let me know in the comment section and I'll highly appreciate it. Thank you so much for now.